Speech delay and autism are often misunderstood as overlapping conditions due to their impact on communication. However, their distinctions are crucial for accurate diagnosis and effective intervention. In this video, I will clarify their differences by focusing on important characteristics. Children with speech delays still explore their voices through babbling and cooing. They often use nonverbal cues like eye contact, pointing, and gesturing to communicate their needs. This is in contrast to children on the autism spectrum who may not use these nonverbal communication methods. They limit their eye contact with other people, and they have limited capacity for facial expressions, gestures, or pointing. Children with speech delays are typically motivated by social responses. They seek interaction, enjoy hugs and smiles, and desire to build social bonds with peers and caregivers. On the other hand, children with autism might struggle with social interactions, show less interest in peers, and find it challenging to build social connections. Children with speech delays usually respond positively to attention and mimic the behaviors of those around them. They are able to mimic gestures, sounds, and facial expressions. The desire to imitate is often a sign of eagerness to learn and communicate. In contrast, children on the autism spectrum rarely mimic gestures, sounds, or facial expressions. They might have difficulties mimicking actions and expressions of others. Children with speech delays usually respond to their names by turning their heads towards the sound and making eye contact with the person calling their name. Despite having normal hearing, the responsiveness might be absent in children with autism, who might not react to their names being called. Children with speech delays generally follow the same developmental trajectory as their peers, but at a slower pace. In contrast, children on the autism spectrum might show differences in their developmental patterns, particularly in terms of social and communication skills. Children with speech delays are responsive to social cues like waving and interacting with others. On the other hand, children with autism spectrum might struggle with recognizing and responding to these cues. While children with speech delays might playfully repeat words or phrases, it's not usually a fixation. They typically take advantage of expected actions and behaviors. In children with autism spectrum, repetitive behaviors can become obsessive and all-encompassing. There is a possibility of recurring stereotyped or unusual actions, movements, or interest. Children with speech delays engage in pretend play and can use toys appropriately, enjoy playing with peers. In contrast, children on the autism spectrum don't have pretend play or can't use toys appropriately, may only play next to others, but not with peers. Children with speech delays understand a word first before they use it, understand more than what they say. Children with autism have unusual pattern of language development. They may say more than they understand. Speech and language issues include word order, grammar, vocabulary, and speech sounds. On the other hand, autism are related to communication, social interaction, repetitive behavior, and sensory issues. As we know, once kid is diagnosed with autism, we have very short span of closed window to recover. So knowing this difference about speech delay and autism are important for all parents. Thank you.